Welcome to the American Institute of Healthcare Professionals video on signs of mental illness. And we're going to emphasize today the importance of mental health. Many times individuals dismiss symptoms of negative symptoms of mental health because individuals do not take it as serious as one's physical health. So if someone comes down with a cough or a fever, they call the doctor. They call their primary physician and they seek the medical help they need. However, if someone starts to have anxiety or they might feel depressed, then automatically there is this stigma where the mental health symptom is not addressed. It is not looked into or given the proper focus that it properly deserves. So, mental health needs to be a priority. So, if it is a priority, then we are more able to diagnose and see where problems are emerging with individuals who need the help that they need to get. Usually, most mental health care issues are correlated with an imbalance, and that imbalance occurs at the neurotransmitter level and it can be easily fixed. Sometimes it's as simple as an imbalance in serotonin or dopamine, and those things can be easily fixed and rebalanced through proper medication. Most individuals have only minor mental illness issues, dealing with anxiety, minor depression, ADHD, or even OCD. But as minor as these things are, they can cause a lot of turmoil in one's life if you're constantly nervous or you're constantly worrying about things that shouldn't be an issue, or you are far too rigid and ritualistic, or you seem to be sad over something, but you really don't know what it is. These things can become very problematic for functioning in an everyday life. And you ask anyone with these types of situations that they deal with on a consistent basis, maybe ADHD, and they can't focus on one thing. Well, then life becomes very difficult when you ask these individuals how their day goes. So, if symptoms, no matter how minor, manifest longer than 2 weeks, then a mental health care professional should be sought out according to professionals. So, anything longer than 2 weeks out of the ordinary is something that really needs to be looked at. Again, avoid the stigma of going to see someone for a mental health issue. Treat it as equally as you would a cough or a fever with a primary physician. Mental illness, like any issue, can be acute or chronic. It can be something that just arrives due to various situations within the body, chemical reactions within the body at the neurotransmitter level, or it could be something genetic manifesting or something from a past trauma. It might be something that is here and there and gone, or something that is chronic that will be an issue that you have to deal with for the rest of your life. And again, people deal with physical issues for their whole life, no matter what. Uh, most individuals might have high sugar levels, or some individuals might have higher cholesterol, and it's something they have to monitor. Well, in the case of mental health, sometimes issues are not acute, sometimes they are also chronic. And again, that's not something that is going to ruin one's life. And it shouldn't be a stigma. It's something that someone has to focus on through various counseling techniques or necessary medications. So if something new emerges, especially, it's important. But if you have been dealing with various symptoms related to mental illness or mental pathology, then it's time to get help. Some issues just suddenly arrive due to a particular incident, but other issues and symptoms can be due to past unresolved trauma. If something very traumatic happened in your past, it could be due to abuse that occurred in the past. And it could also be due to unhealthy attachment bonds that were learned in your youth. Maybe you were not giving secure, trusting bonds with a caregiver, and instead you were mistreated. Your needs were not met. and you weren't able to form trust and bonds with other human beings at the earliest level. And these are things that Erik Erikson talks about in our 8 basic needs. And if these needs are not met at an early age, then pathology can later emerge in young adulthood in terms of forming these. So unresolved past trauma, abuse, bad attachments can all later manifest, in addition to anything that might be genetic in terms of with neurotransmitters. So what can these issues lead to? Well, they can lead to a little bit more serious, moderate to serious mental health, depending on the extremity of it, beyond ADHD, beyond OCD, beyond maybe anxiety or mild depression. It can lead to issues that are related to PTSD or post-traumatic disorder, attachment disorders themselves, depression, bipolar depression, borderline personality disorders, dissociations that occur that are highly closely related to PTSD, various psychoses that can occur, or antisocial personality disorders at their worst levels. So these issues can just be beginning to emerge, or they have been emerging. And for the more serious ones, definite clinical therapies need to be introduced, sometimes also with medications, so that the individual can live a normal and productive life. And again, just like any problem that occurs physically with one's health, whether it's, again, a simple cough, fever, or a more serious issue with your blood pressure or your sugar levels or your heart, you immediately go to a specialist. If these more serious or moderate mental pathologies begin to manifest, you go to a professional in mental health. So with these symptoms of mental illness, it is important to look at frequency and intensity. These are 2 of the key things. How frequent are they? And how intense are they? And those are going to be 2 big measuring sticks on what needs to be done. Obviously, anything that persists longer than 2 weeks is the gold standard in terms of seeking help. But does it reoccur throughout the year? And when it does, how intense is it? How debilitating is it? Now, again, there could be high functioning individuals with high levels of depression and anxiety, but the intensity is very much a thing of how the person experiences it. How much does it affect the person, whether they're functioning or not? Most cases, they won't be functioning, but if they are not functioning, how are they feeling inside in terms of a crisis with inside their own soul? Also, changes in mood are something that dictate a possibility of a mental pathology. So if you're usually a happy individual and suddenly you're feeling sad, or you're feeling anxious, or you're more of an extrovert, suddenly you do not want to go out. What is causing this change in mood? Physiologically, there can be a lack of interest in a lot of things you love to do. Your appetite can change and what you like to eat. Sleep changes are something really to watch out for. Cognitive changes, delusions, psychosis, confusion, worry, and higher levels of anxiety are all symptoms of something that is more pathological and dangerous to your overall health. And again, symptoms that you would notice from a physical standpoint are investigated. These symptoms, if you see them in your life, or if you're a counselor, or you are a professional, or a family member of someone who's experiencing these symptoms, it's time to up the game in terms of helping. Remember, no stigma. In the past, mental illness has been associated with weakness, men don't cry type attitudes, or even crazy asylums and things of that effect. And that's not the case. Most mental illnesses and pathologies can be easily dealt with through medication and counseling itself. Most are treatable. But if you ignore them, your quality of life is going to decrease, and it's going to cause problems in your work. It's going to cause problems in your academics. It's going to cause problems in your family life. And also, it could lead to a greater physical problem later down the road. Sometimes these symptoms that you think are just mental are actually physiological symptoms of something physical going on in your body, maybe in your brain, maybe a tumor of some type is affecting something that is making these other symptoms appear. So it's important when something is off, whether it's physical or mental or emotional, that you find the help you need. It's important to take control of your mental health. So, we are the American Institute of Healthcare Professionals, and we offer a wide variety of certifications that help individuals that are professionals from the clinical side of the aisle or on the pastoral side of the aisle, help other people deal with grief, stress, anxiety, anger, those in crisis, and help find ways to help them. Now, individuals who are clinical obviously can treat deeper pathologies because they're licensed. Certified individuals, however, who are not clinical, that are more of a pastoral level, they cannot treat pathology. So it's important to notate that this certification serves both parties, but there are limitations based upon one's licensure and their training at the state and academic levels themselves. Below is our site link where you can review some of our programs, as well as our phone, which is 330-652-7776, and our email at info@aihcp.org. I'd like to thank you for listening. Take care of your mental health and have a good day.